Joining us live on the line is Director of Tropical Infectious Diseases and Research and Education Center, Professor Dr. Sazaly Bakar, to help us put things into perspective. Thank you for joining us, Doctor.
Good evening.
Doctor,
Hello?
Are you there? Hi.
Yeah. Yes,
Hi,
I'm
Doctor.
here.
Thank you for joining us.
Yeah, I'm glad to be here. Thank you.
All right. And now, Doctor, we know that there are cases where people could be, carriers of the virus, so they wouldn't necessarily show symptoms right away. How can the government detect these people using thermal scanners? And are thermal scanners effective as a preventive measure?
Yeah, I mean, right now that is an issue facing, I think, health authorities because this virus, unlike the previously known SARS virus, during the incubation period, the virus can still be secreted and be transmitted to the next person. So now I think the challenge is to get diagnostic to be done almost immediately for those who are suspects. I mean, if you know that that person is in contact with someone who has been infected before, or if you have a person who is feeling a bit unwell and coming from an area in which the virus has been reported, I think it's important to get that person sample to be tested for the presence of virus almost immediately. I mean, without having to wait for the person to be identified as having the fever and so on.
Okay, now, Doctor, the Deputy Prime Minister yesterday assured that Malaysia has the capacity to handle the situation. What are your thoughts on that?
Oh, definitely. I think we have handled the outbreak, the Nipah virus outbreak before successfully. And we handled the H1N1 pandemic quite successfully too. And we were able to limit the SARS virus from spreading in Malaysia too. I think we have been blessed with those workforce that are competent and highly skilled. We have been trained, we have had the experience, and I'm confident that it will be no better this time around. I mean, we should be able to tackle this if it comes to point in which we will need to deploy all the resources. We do have the resources in Malaysia at this point.
All right, now looking at the latest death toll, 81 people have died as of today, and there are 2,744 confirmed cases of infection. Now, how significant are these numbers, especially in terms of the death rate?
Yeah, if you look at the number of deaths, it's actually about 81. I think the latest was 2,853 confirmed cases with 81 deaths. So if you calculate the case fatality rate, it's only about 3%, even slightly less than 3%, which is just about the number of deaths you would expect from unvaccinated measles infection or unvaccinated whooping cough infection. So it is not that high in comparison to Nipah virus, in which we have a case fatality rate of about 40%. Or even MERS coronavirus, which is the fatality rate was about 35 or 36%. So at this point, it is even lower than SARS, because SARS was about 10%. So, I mean, as it is now, yes, the incidence is increasing, but the case fatality has remained quite stable, at least for the last few days.
Now, SARS was said to have, killed 800 people and infected about 8,000 people. Now, comparing SARS to the novel coronavirus, how lethal is this coronavirus?
As I mentioned earlier, the case fatality rate now is just about 3% in comparison to SARS, which is about 10%. So as it is now, as it stands now, it is not as lethal as SARS.
Okay. All right, and finally, Doctor, people are now urging the government to deport Chinese tourists back to China like the Philippine government is doing. How effective would this be? Would it actually work to contain the virus?
No, it doesn't work that, because, I mean, if those tourists, they are our guests, and if they are perfectly well and they're not having symptoms, there's no reason why we should deport them. Even if they are infected, they are positive, I think they should be treated as how we would like to be treated if we are sick in their country too.
Okay, thank you so much for joining us tonight, Professor Dr. Sazaly, and it was very insightful. That was Professor Dr. Sazaly Abu Bakar, virologist and biosafety expert from TIDRAC.